All right. Hi, everyone. My name is Josie Marshall, and I'm a part of the DSHA senior class of 2025. I am so excited to introduce our second speaker of the evening, DSHA's 2024 Young Alumna of the Year, Dr. Brittany Mays, DSHA class of 2009. In the summer before her senior year at DSHA, Dr. Mays was selected to participate in the Apprenticeship in Medicine program at the Medical College of Wisconsin. The group engaged in a 6-week program and participated in clinical shadowing, laboratory research, and more. She was nominated by the DSHA Science Department, and that program solidified her decision to pursue a career in medicine. She went on to obtain her bachelor's degree in biology from Xavier University and her medical doctorate at the Medical College of Wisconsin. She completed her residency training in physical medicine and rehabilitation at the University of Miami, and then completed her United Council for Neurologic Subspecialties Headache Medicine Fellowship at Brigham and Women's Hospital, a teaching hospital of Harvard Medical School. She is now one of only 4 physical medicine and rehabilitation-trained headache medicine specialists in the entire country. I am so proud to introduce Dr. Mays as our Young Alumna of the Year. As someone who hopes to pursue a degree in microbiology and go into medical research, I find her journey absolutely inspiring. Congratulations, Dr. Mays.
My goodness. Thank you so much for that awesome introduction. It is a pleasure to be here with all of you today. It is truly an honor to be standing here as the Divine Savior Holy Angels Young Alumna of the Year for the year of 2024. I would like to congratulate my fellow awardees, Meg Haggerty, I thought she was, there she is, Meg Haggerty, and Tony Harrison Friedman, as you both continue to serve as an inspiration to the DSHA community. DSHA has been a foundational cornerstone of my education, and it is with pleasure that in these few moments together that I share a bit about my journey. From early childhood, my parents instilled in me the phrase, "It takes a village." With time, I came to understand and embody the teaching myself. I matriculated to DSHA from Milwaukee Montessori School, where for 11 to 12 years, my family and my home was with my classmates and my teachers there. It was at Milwaukee Montessori School that I first discovered my interest in science and mathematics. The Montessori methodology allowed me to have an individualized curriculum, which further accelerated my skills in these subjects. As such, when my parents decided and discussed options for my high school education, DSHA was the natural choice, given the robust college preparatory curriculum, along with my parents' shared beliefs in the qualities of a DSHA graduate. August of 2005, I arrived at the doorsteps of 4527 North Honda Street, this sprawling tan brick building where I was set to spend the next 4 years was both welcoming, and as an introvert, it was quite daunting. I received if you all remember this, I received my yellow and red annual planner, and I clutched this closely as I navigated the hallways to the sound of the first bell. I sat quietly at my first desk when, honestly, doubt began to set in. I was slowly realizing how different I was in comparison to my peers. In hearing their conversations, I questioned where I could fit in. I was not the loudest in the room, nor the funniest, nor the most athletically gifted, nor the most artistic. I came from a different faith background, and the most poignant fact being that I was one of 6 Black women in my class of 165 young women. How was I to find myself? How was I to truly flourish? The novelty of it all I found overwhelming initially. However, one class later that afternoon helped to change my trajectory at DSHA. I was sitting in my first world history class when I was greeted by Mr. Patrick Dawson. Yes, absolutely. He created a warm and welcoming classroom environment, one of inquiry, one where differences of opinions were encouraged and supported. He presented historical facts, and then he would allow us to critically evaluate them. He encouraged active participation, and as such, helped me to learn that my voice was meaningful and valuable. My confidence in the classroom quickly grew thanks to my exceptional teachers at DSHA. I can recall my parent-teacher conference reports evolving from Brittany is a bit quiet, could participate more, to Brittany is an active participant and leader. I excelled in my many STEM classes while concurrently being able to explore my new interests such as history and economics thanks to Mr. Dawson, Miss Gooley, and Mrs. Weiss over there, which contributed to my well-rounded education. Because of my success in the STEM classes, however, at DSHA, I was nominated by the science department to participate in the Medical College of Wisconsin Apprenticeship in Medicine program, which was a summer program that forever changed my life and I decided at that point that I was committing my life to a career in medicine. So throughout my time at DSHA, while the classroom remained my safe space where I was allowed to use my voice and my voice was truly heard, I learned that my voice also had value outside of the classroom. I recognized that I could use my voice to uplift my community and to advocate for those from traditionally underrepresented backgrounds or marginalized backgrounds. My leadership in the classroom led to my assuming leadership roles outside of the classroom. I volunteered as a mission student recruiter, as I truly believe that all young women in the greater Milwaukee area, regardless of background, should have access to a DSHA education. I also led the Sisters of Culture Club to help promote inclusivity in our learning environment. Beyond my many years at DSHA, in this grand scheme of medical training, my confidence in my voice has afforded me many leadership opportunities. Some of these opportunities have included serving as the first Black woman as a chief resident at the University of Miami, where I did my residency, to becoming the first physiatrist to pursue a career in headache medicine and headache medicine fellowship at the Brigham, to my most recent role of serving as the sole headache specialist for Vanderbilt University Medical Center. Finding my voice at DSHA has been an incredibly impactful skill, but arguably learning to be an active listener has been of even greater importance in my career. One cannot advocate without listening and hearing the community one is serving. In my current role as an assistant professor and clinician educator, I teach various levels of learners from undergraduates to clinical fellows. It is my goal to always create a supportive and safe learning space emulating my experience here at DSHA. Clinically, I often serve as a second opinion or last hope for many of my patients who have suffered catastrophic injury or those who struggle with debilitating headache diagnoses. Listening to my patients share their medical journey with me allows my patients and I to work as a team to create individualized treatment plans where I see success come to fruition. In a time where healthcare systems are under scrutiny, physicians are retiring and quitting medicine at accelerated rates. What keeps me going each day is the feedback that I receive from my patients, and this serves onus to my active listening skills that I've obtained at DSHA. I would like to read a few comments that I've actually received from patients over the last couple of months, if I may. Dr. Mays has reviewed my chart prior to my appointment, which was helpful, but she was an attentive listener. She clearly explained treatment options. For once, I felt heard in my medical care. Dr. Mays listened to my questions and offered more and or clarifying information. I really appreciated how she included my input in choosing the next steps to fit my needs. I believe that these comments demonstrate a theme of being heard and listened to, which helps keep me going in my career. Additionally, I know that I now carry the torch to mentor and teach the future of medicine. What also keeps me going is that the reminder that even in 2024, women only represent 38% of the active physician workforce in the United States, with only 2.8% of those being young Black women. I believe that DSHA is doing its part in helping to alleviate this disparity of women in medicine. DSHA's history of supporting and producing young women who enter the STEM fields is unparalleled in Milwaukee, as evidenced by my several classmates and trainees at the Medical College of Wisconsin being alumna of DSHA. I was recently asked to give remarks at the Medical College of Wisconsin for their summer program graduation, and I was actually so encouraged to see so many students, current students of DSHA participating. And my hope is that DSHA will continue to expand in science and mathematics course offerings and continue to grow the STEM Scholars Program with your assistance. Also, with your ongoing contributions, I believe DSHA will be successful in these efforts. I would be remiss if I do not thank my village that has been part of this incredible journey. To my DSHA community, as I've mentioned, Mr. Dawson, Mrs. Weiss, Mrs. Gooley, the late Miss Sue Righty, who I will never forget. I took her anatomy course after participating at this Medical College of Wisconsin program, and I was real confident when I came back to her anatomy course, and she embraced me and let me teach my colleagues. Mrs. Ellen Bartel, Mrs. Mary Beitzel, Miss Vicki Modra, Miss Claudia Sanders, who's still here, and she's lovely and always greeted me and supported me during my time here. My Xavier University community, Dr. Paulding, Dr. Close Jacobs, the Medical College of Wisconsin family, Dr. Don Bragg, Dr. Candace Lavelle, Dr. Malika Syker, Dr. Alonzo Walker, my University of Miami family, Dr. Shanae Price, Dr. Tisha Monteith. I have ongoing mentorship with faculty at several institutions, including Stanford, Dr. Nunu Zhang, Harvard, Dr. Rebecca Birch, my current colleague at the Headache Center of Excellence in the Nashville VA, Dr. Krista Brooks-Herrera. And lastly, saving it for last, my family, my wonderful parents who set this process, this journey in motion. I expressed to them at an early age that medicine was something that I was interested in. My mom handed me a stethoscope while my dad put on a little white coat. So my dreams would not have come to fruition without you. To my grandparents that, oh yes, absolutely. To my grandparents that are no longer with me. They have been such an intricate part of my journey as well, and I think they would be so proud for this recognition today and being able to come back and speak with you all. To my aunts, I have a really big family. To my aunts, my uncles, my cousins, my godparents, and my newest addition to my family, my husband, who is home. We just relocated to Philadelphia, so he's home getting things managed there and taking care of our wonderful Bernedoodle Autumn. So with that, I thank you again for this honor. It is truly a pleasure being here. Thank you so much for your time.